started with exploring their kitchen. We asked them to take out everything they had so that we could see what they were using every day. The health system is designed for Americans, right? Because it's the American health system. When dietitians were recommending foods to the immigrant community, they are usually providing recommendations in the American perspective, like oats and bread and maybe soups and salads, but that's not how every culture eats. It was important for us to bring that insight that different cultures have different food. This is the guide in English. The Afghan food guide is a culturally tailored food guide that informs people about the different nutrition components, but at the same time highlight the Afghan food culture. Because when we as providers counsel them or suggest something to improve their health, it should be something that they are familiar with. The Afghan food, the staple is rice and red meat. You can see pulao, which is basically rice but with ingredients like carrots put in there. There are kind of dumplings, but Afghan dumplings, you might say. You can see different kinds of bread in the Afghan diet. When you look at the meal served on the table, it's already balanced, but then it all depends on how people take in the food in their plate. There are pages with 2 pictures comparing different platings, and the dietitians can show and say, now this is the preferred dietary serving. The third section has special dietary advices like for pregnant women, for children, and also during Ramadan, where people go into fasting. The participants were really happy when they were sharing about their food. It's good that we have at least one guide that brings this kind of food into the discussions to show them that we understand how you eat, we understand your culture, so that they can trust us with what we're advising them.